Care patients have suddenly been cut off from their go-to doctors. Austin Regional Clinic says they knew they would not be an in-network provider with United Healthcare beginning next year for Medicare Advantage patients.
But as KXAN's Eugene Cho explains, that change seemed to have gone into effect 3 months earlier than expected.
My Medicare Advantage plan just dropped my doctor. Can I now change to a different plan? Unfortunately, the answer is no. Hi, my name is Christopher Westfall. I'm a licensed insurance broker, and I specialize in Medicare insurance for seniors. Unfortunately, this is a very common question that we get all the time. Either the HMO, the Medicare Advantage plan, or the doctor will drop their participation in the plan.
United Healthcare told us in a statement, Austin Regional Clinic providers are still considered to be in-network. But that's not what Casey Cerny experienced this week.
What's going on? What brings you in today?
Cerny has been seeing Dr. Anas Dagestani at ARC for about a decade, when he got this letter saying he's been assigned a new doctor starting in 2 weeks.
You see, a contract has two components. In this case, the doctor and the health plan. The health plan exists solely to provide care at the most inexpensive cost possible. They are funded by the U.S. government, the Medicare Advantage plans, so that they can provide care in a very efficient way.
Tuesday morning of this week, I duly phoned. I said, I'd like to stay with Dr. Dagestani through the end of the contract. I don't want to go to somebody else. And I get put on hold. Some minutes later, she returns and says, I will not be able to reassign you to Dr. Dagestani.
The reason, the woman told him?
Well, he's been termed.
Unfortunately, these doctor contracts are not always calendar year contracts, and either the doctor or the health plan can choose not to renew. So the question, if the Medicare Advantage plan drops your doctor, does that give you a special election period, it's what they call it, to go into a new Medicare Advantage plan where your doctor may be participating? And sadly, the answer is no. Your contract is an annual contract from January to December 31st to stay on that health plan, come hell or high water. There are only a few examples of reasons why you can get out of that health plan, but for all intents and purposes, you are stuck with that plan once you're on a Medicare Advantage plan for that entire calendar year. The doctors, as I just mentioned, however, have different contracts that can be terminated early for breaches, or either the doctor or the health plan can choose at their leisure to not renew that contract.
Really what caught us off guard is the quick cutoff of the patient from their physicians.
ARC says they've heard from thousands of their patients.
Losing access to their doctor in a period of 2 to 3 days is just not right, not ethical, and we're very concerned about it.
Unfortunately, with CMS, that's the Center for Medicare and Medicaid Services, losing your doctor on a health plan does not qualify you to go to a different plan. Now, we have mostly Medicare supplement clients, and that's because with a Medicare supplement, unlike an Advantage plan, you can go to any doctor that accepts Medicare, which is most every doctor. Similarly, if a hospital network has chosen to not participate in Medicare Advantage anymore, you can't go to that facility. One of the little known caveats to having a Medicare Advantage plan is that if you go to a provider that's not inside the network on an HMO plan, on most all Medicare Advantage plans, that means it's completely not covered. Many seniors, again, in error, believe that they can go inside the network and take advantage of the health plan and go outside the network and take advantage of Medicare. You can't. Once you're on a Medicare Advantage plan, you no longer have access to every provider that otherwise accepts original Medicare. See, that's the problem, that many agents unfortunately don't describe the limitations of the Medicare Advantage plan. The best aspect of the Medicare Advantage plan is the premium. In many cases, there is no premium. And sometimes that fits you. If you're in great health, if you live in an area with a great network and your benefits are superb, then that Medicare Advantage plan may be a great fit for you. If you're tied to your specific doctor or group of doctors, specialists, hospitals, clinics, labs, that you insist that you want to go to the best of the best in your mind, then you may want to reconsider a Medicare Advantage plan for your needs. Yes, it would cost more to have a Medicare supplement plan, but sometimes you get what you pay for, in that you can have the freedom to go not only in your local area, but anywhere in the entire United States that accepts Medicare Doctors, hospitals, clinics, outpatient x-rays, labs, MRIs, all that stuff is within your purview, and you can use it if you have original Medicare and a Medicare supplement plan.
What is clear is this: if the affected patients want to stay with their ARC doctors next year, they will have to find a new insurance plan. They will learn what their options are on October 1st. But until then, many patients worry about the 3 months they may not be able to access doctors they've known for years.
I think the basic solution is none of us are going to get sick.
Yujin Cho, KXAN News.
Wishful thinking.
So sadly, if your doctor or your health plan chooses to terminate the relationship with each other and you're caught in the middle, as is often happening in the news as we see today, unfortunately that does not give you the right to go out and get a different plan. You can only get a different plan during the annual election period for the next January. So that's October 15th through December 7th, picking a plan that starts the next January. So, if a Medicare supplement plan is best for you, or you want to consider what Medicare Advantage plans may be best for you, our service is completely free. Consider giving us a call. We're at 1-800-729-9590. Again, my name is Christopher Westfall, and I hope this has been of help to you.